Imagine a future where millions of older adults and vulnerable populations lose access to essential healthcare and long-term care services. This is not a dystopian fantasy, but the stark reality promised by the Budget Reconciliation Act of 2025, also known as H.R. 1. Signed into law on July 4, 2025, this legislation slashes over $1 trillion from Medicaid, Medicare, and the Affordable Care Act, ACA, threatening the well-being of millions. But here's where it gets controversial. While proponents argue it's necessary for fiscal responsibility, critics warn it will disproportionately harm low-income older adults, people with disabilities, and their caregivers. Let's dive into what this means and why it's sparking such intense debate. The devastating impact on healthcare access. H.R. 1 is projected to strip Medicaid coverage from between 7.5 million and 10 million low-income individuals, leaving 15 million people uninsured. This isn't just about numbers. It's about real people facing life-threatening consequences. Several provisions in the law create bureaucratic barriers that will block older adults from accessing the care they desperately need. Section Work Requirements, a double-edged sword. Starting January 1, 2027. Adults aged 19 to 64 in Medicaid expansion states like Wisconsin and Georgia must complete 80 hours of qualifying activities monthly to maintain coverage. While exemptions exist for certain groups, they are narrowly defined and often fail to account for the realities of older adults who cannot work due to health issues. And this is the part most people miss. To prove eligibility for these exemptions, individuals need medical documentation, but without Medicaid, they can't afford the care required to obtain it. It's a catch-22 that could leave many without coverage. Second, retroactive coverage cuts. A blow to emergency care. The law reduces retroactive Medicaid coverage to just 1 month prior to application for expansion enrollees. This change undermines the ability of individuals to receive emergency care and complete the complex enrollment process in time. Providers, too, face uncertainty about reimbursement, potentially delaying critical services. Frequent renewals. A recipe for coverage loss. Renewing Medicaid eligibility every 6 months instead of annually will likely lead to coverage terminations due to procedural issues like lost mail or incomplete forms. For older adults already navigating complex healthcare systems, this added burden could be insurmountable. Cost sharing. Delaying care for the vulnerable. Starting October 1, 2028. States will impose cost sharing for Medicaid expansion enrollees with incomes above 100% of the federal poverty level. This could force low-income older adults to delay or forego necessary medical care, worsening their health outcomes over time. Long-term care in crisis. H.R. 1 also targets long-term services and supports LTSS, which are lifelines for older adults and people with disabilities. By tightening eligibility requirements and reducing funding, the law jeopardizes access to Medicaid home and community-based services, HCBS. Here's the controversial part. States may cut optional programs like HCBS to save costs, forcing individuals into nursing homes and straining family caregivers. Is this really the solution we want for our aging population? Nursing home staffing moratorium, a risk to safety. The law delays the implementation of minimum staffing standards in nursing homes for a decade. This means chronic understaffing will continue, increasing the risk of neglect, preventable injuries, and even deaths among the most vulnerable seniors. Is this a fair trade-off for fiscal savings? Home equity restrictions. A cruel dilemma, effective January 1, 2028. The law caps the home equity exclusion for Medicaid LTSS eligibility at $1 million. This could force older adults in states with higher limits to sell their homes or lose access to essential care. For many cash-poor, house-rich seniors, this is a devastating choice. Broader implications. A ripple effect of harm beyond Medicaid. H.R. 1 strips health coverage from millions of others, including dual-eligible seniors, lawfully present immigrants, and ACA Marketplace enrollees. Hospitals face a surge in uncompensated care, and rural healthcare providers risk closure, further exacerbating disparities. But here's the question. Is dismantling these safety nets the best way to address budget concerns, or are we sacrificing the most vulnerable for short-term gains? What's next? Justice in Aging is monitoring the implementation of H.R. 1 and providing resources for advocates. But the fight is far from over. As these changes take effect, we must ask ourselves, what kind of society are we building? One that prioritizes fiscal responsibility at the expense of human lives, or one that protects the most vulnerable among us? The debate is far from settled, and your voice matters. Will you join the conversation and advocate for a fairer future?